Welcome to our virtual open house. Due to COVID-19, we can no longer host everybody in our office, so we wanted to give you guys an introduction to our practice. My name is Ritu Sharma, and I'm a board-certified internal medicine and pediatric doctor.
My name is Ray Santos. I'm also a board-certified internal medicine doctor and pediatric doctor. And this is DRS Medical Associates. We built this practice in 2015, and 5 years in, and we're still serving the community. And we'd like to welcome everyone, especially our newborns that are coming in. Our office hours are convenient. We make it convenient for everybody else in the community. So Mondays through Thursdays, our office hours are 8 a.m. to 6 p.m. Our weekend hours, which are Friday, Saturday, and Sunday, are 8 a.m. to 4 p.m. And we can be reached beyond office hours if there's any emergency questions from our parents. You may call the same office number, and it'll prompt you to speak to us. You press the number 9. It'll go directly to our cell phone if you have any questions.
We are able to accommodate sick and urgent visits the same or next day. Please call the office and we will try to schedule you at a time that's convenient and safe for you as well too. For any non-urgent questions, you can also send us a message through the patient portal. It's a secure HIPAA-compliant portal that we have unique to every single patient. You can also call the office number and speak to one of our staff members with any questions that you have the same day.
During the pandemic, we try to make it as safe as possible. So we are controlling the flow of patients in and out of the office. We're scheduling one patient at a time. For our parents, we invite one parent to come with a visit with the baby, and the other parent, we can do a televisit, we can do a FaceTime video call with them to keep them involved. Our staff are, of course, wearing masks. There are temperature screenings at the front of the building for everyone coming into the building. And we thoroughly clean each room after each visit, and we have hand sanitizers everywhere. So we try to keep it as safe and as clean as possible, especially during this pandemic.
For all non-urgent questions that you have, you can call the office during office hours and any staff member will be able to help you. If the staff is unable to answer your question, they will leave a message for one of the doctors, and then someone will return your phone call and be able to answer your question that same business day. If you are unable to reach us through phone and you want to send us a message through the secure patient portal, the message gets directed either to the doctors or to the staff members, depending on what the query is. And we will respond to you within a 24-hour period with that answer. For all urgent questions, please call the office regardless of whether the office is open or closed. During office hours, the staff will help you out and let you know if we deserve to see the patient in the office, whether we can schedule a virtual televisit, or if the patient needs to be seen the next day or can come in at another time. For any urgent matters after hours, one of the physicians will answer the phone call. So there is a prompt to speak to the doctor that's on call, and either myself or Dr. Santos will answer your phone call at night.
The most important thing we can do for our kids nowadays is to vaccinate them and immunize them, get them all the immunizations necessary. These are for avoiding preventable diseases. So we have a vaccination policy in the office. All our kids, all our patients have to get vaccinated at the appropriate time and schedule. They're supposed to get vaccinated. Again, this is the most important care that we can provide to our kids to prevent illnesses that are totally preventable.
So we follow the CDC and AAP guidelines and schedules. We feel these schedules and guidelines are safe and effective. Both of us have our children vaccinated with that particular schedule and guidelines. We recommend that everybody in the community gets vaccines as per that schedule, so that way we may protect the most vulnerable people from all these diseases. We recommend that everybody in the family also receives their vaccines, not just children. So if you're expecting a newborn child, please get your Tdap. If it is flu season, please also get your flu vaccine.
I think the added advantage of seeing adult medicine and pediatric medicine is that it gives us the extra level of understanding the different dynamics that go along with different families and cultures and different neighborhoods. We're able to understand the complex illnesses and social dynamics of the adult world, as well as the complexity and the added touch that we need to do with the pediatric patients. So doing both adult medicine and being able to do pediatric medicine gives us that level of advantage and extra level of understanding, and I think that's what gives us that advantage.
So one of the most common questions I get is, what is my approach to medicine and child rearing? Well, the first thing we do is always take a look at science and evidence-based items to be able to answer any questions, any problems we have, any illnesses we have. So if your child needs medications to get better, we will let you know that your child needs a medicine to get better. Sometimes a child needs changes in diet, changes in the home, changes in lifestyle to get better, and we will let you know if those changes are necessary for the child to get better as well too. As far as child rearing is concerned, there's not any one particular approach that's the best way to look at things. There's a style of parenting called good enough parenting, which means you do what is good enough for your child. So one child in one family may need a certain approach to things. Another child in that same family may need yet another approach to things. Another family may yet need a yet another approach. The advantage that we have is that we often see the entire family. So we can tailor all your treatments to your family, to your culture, to the diversity that's in your population as well, too.
After the baby's born, there's a lot of excitement. There's a lot of emotions. Everybody's taking pictures, videos. Let that settle down. Enjoy it. I think the best time to call us to tell us that the baby's born and book that first appointment would be when the hospital staff gives you the paperwork for the birth certificate and the Social Security and all the other paperwork they need to give you and you need to fill out. I think that's a good time to take a little pause from the excitement and just give us a call. Let us know the baby's here. When can we see you? So we usually see the baby within the first few days after being sent home from the hospital. It's key to have a couple of nights under your belt at home and kind of get settled in, and then come in and we'll see you guys and we'll see the baby. Now, 95% of the time, everything went well at the delivery, the pregnancy was okay, and we have that time to get settled at home, and then we'll see the baby in a few days. There are certain situations, for example, as common as jaundice, and there's a bilirubin buildup in the baby, and the hospital staff recommends getting the baby seen within the next day or within 24 hours after discharge, and we're able to accommodate that as well. So once you hear that from the hospital staff, if you need to be seen by the next day, just call us, and we'll get you guys in, we'll get the baby in. Another important thing to remember at the hospital with all the paperwork that's going to go around is that newborn screen. So all the babies born in the United States have a newborn screen test that's done at the hospital and sent to the lab, to the state lab. Just notify the hospital staff that you're going to be coming to DRS Medical, so that way the newborn screen test results, which come back weeks later, can go directly to us.
Complete list of insurances that we participate in is in our website at www.drsmedicalassociates.com. You can also call the office and speak to one of the staff about any particular insurance or any questions that you have about that.
Okay, so we always get asked the question, what's the schedule of the checkups? Okay, so we pretty much follow the guidelines of the CDC and the AAP. So there's the first newborn checkup, which is going to happen the first few days after being sent home from the hospital, after the baby's born. And then we check on the family at the 2-week-old checkup. Make sure everything is going well, the baby's gaining weight, parents are thriving as well. And we have our schedule of vaccines. So we have the 1-month-old checkup, 2 months old, 4 months, 6 months, 9 months, and 12 months. So that's the first year. What we try to always do at our checkup and our visits is that we give anticipatory guidance. We tell the parents when to anticipate what to expect. So with every visit, we're going to say, these are the vaccines that are due for this visit. These are the checks that we're going to talk about, developmental milestones that we're going to go through. And then what milestones you're going to expect before the next visit. What visits, what vaccines are going to be given at the next visit, and when the next visit will be. So we guide you through the process. So it's pretty automatic for the parents. So we give you guys less things to worry about, because you need to worry about, feeding the baby, getting some sleep, and make sure everything is okay. So the schedule of visits, we take care of that. It is on our websites, on the CDC website, the AAP website. We just follow those guidelines, but we anticipate it, and we tell you how to anticipate it, so that way there are no surprises. The vaccines are given at this schedule, the visits are done at this schedule, and we walk you through the process, so no worries.
Anything that's needed to be done during a routine visit is done in the office. We do the vital signs, we do the growth charts, we do the vaccinations in the office. If the child is coming in for a sick visit and needs to have a strep test or flu test or a test for a UTI, we can do that in the office as well too, and we get results that same visit. We will soon be offering rapid COVID tests as well too, which we will get the results the same day as well too. In case you need to do an EKG or a lung function test, that is also something that we can do in the office as well. Any labs that need to be done and drawn can also be drawn in the office. We even draw labs on newborn babies. Any urgent tests, we get the results within the same day or next day. Any non-urgent tests we get within about a week. All your results go up onto your patient portal, so you have access to anything 24 hours a day, 7 days a week.
Thank you for checking out our video. If you need more information, you can go on our website, www.drsmedassociates.com, or you can call us at our office, 201-706-3808.
And here at DRS Medical Associates, we look forward to taking care of your family. At DRS, our family caring for yours.